all of us are aware about this pandemic, this situation, but we should not forget that we are talking about breast cancer. We are talking about cancer. And every year, many more people with breast cancer die than patients with coronavirus. So I think it's important to consider the virus. We have to be there. We have to help these patients. Of course we have, but we do not have to forget other potential or very dangerous diseases as cancer. And breast cancer is not an exception. So just 2 or 3 key comments. First, that we have to think about coronavirus, of course, but we have also to take our patients with breast cancer. We should not delay emerging treatments, and emerging treatments are HER2 positive and triple negative breast cancer in the adjuvant, in the neoadjuvant, or first-line metastatic disease. Second, we do not have any evidence that immunotherapy might decrease the life if patients get infected because of the virus. Moreover, there are some data showing that maybe patients on treatment with checkpoint inhibitors do not get worse, even better. Okay, so my last comment here is that we have to discuss this patient by patient, case by case, but don't forget that virus is important, but cancer is as well. So the first thing we are doing, I think, is very similar to other countries, at least in Europe, but I'm sure also in the United States, is that as soon as we start treatment, start chemotherapy, or patients should go to surgery, to all these patients, we look at the antibodies, and also we look at the PCR to be sure that we do not have the virus. Okay, but if the patient has started treatment and she get infected by the corona, of course, during the infection, we stop chemotherapy. That makes sense. But just after, we continue. If we are on treatment with endocrine therapy, we should not stop the endocrine therapy. We can continue. And with immunotherapy in breast cancer, remember that the use of immunotherapy is in combination with chemotherapy. So that's why we also stop treatment, and we continue just after the virus becomes negative. Well, it is the same, but we need to have our eyes even more open with elderly or frail patients. But again, usually elderly patients have more endocrine or HR positive tumors compared to young patients. Tumors are usually less aggressive, so we can be more flexible. But again, if we have an elder patient, an older patient with a HER2 positive or triple negative, I think that we do very similar things. So of course, not only with immunotherapy, with all breast cancer drugs, also with mTOR inhibitors, pneumonitis is something might occur. Also, pulmonary lymphangitis can also happen there. So I think that we have to have our eyes clearly open. Don't forget to think about the virus as well. And if we think that there is something in the CT scan or in the X-ray or because of symptoms, we have to discuss both, to look at if we have the virus and to look at if we have other pneumonitis or lymphangitis. And depending on the symptoms, depending on the assessments, we have to do one thing or the other.